Pain caused by surgical incisions and procedures can be moderate to severe for the patient post-operation, with nearly one-third of those undergoing surgery complaining of it. On a physical level, it is related mostly to the extent of tissue damage at the site of surgery. Patients with a severe level of pain after surgery is currently a large problem, occurring in 20 to 40% of post-operative cases. Chronic post-surgical pain has a global incidence of 30%, while surgery is the second most common cause of neuropathic pain. Correct management and sufficient reduction of this pain while the body heals is extremely important to avoid increased costs and poor quality of life for the individual. The perioperative period as a whole can be stressful for patients, and as nurses assisting them during this challenging time, it is our duty of care to provide the best holistic and evidence-based care that we can to support the individual. The expectation of pain can be anxiety-provoking in many individuals and is actually another aspect that should be considered in the holistic approach of the post-operative pain management plan. Effective pain management post-surgery is challenging due to the high variability and subjective sensory experience of pain. Unfortunately, there is no one-size-fits-all medication or therapy that will be successfully therapeutic for every patient, even if they have undergone the exact same procedure. Another potential issue is some patients' desire for complete elimination of pain. This is rarely obtainable, therefore, it should be established with the patient that a pain level of 0 may be unachievable in the initial recovery stage, and the more appropriate goal and expectation is for functionality. On the other side of the spectrum, there is a barrier in societal fears of opioid addiction and lack of advocacy are also factors, especially in the undertreatment of pediatric pain. This view represents a lack of education. Opioids can play a significant role in the treatment of postoperative pain. Pain management in children is often dependent on the ability of parents to recognize and assess pain and on their decision to treat or not to treat it. Lack of knowledge and attitudinal barriers among health professionals, patients, and the general public contribute to the undertreatment of pain. Postoperative assessment of pain involves a great deal of direct communication with the patient, even more so rather than physical assessment techniques, although these are still used. This is due to the aforementioned subjective nature of a pain experience. We must ask the patient about how they are perceiving it rather than how strong we think it is likely to feel. The numerical scale of 1 to 10 pain rating was introduced to general observations to help identify and quantify the severity of pain a patient was experiencing. It is considered to be moderately accurate and a fair indicator of the patient experience. Information must be gathered from the patient by asking about relevant history and conducting physical assessment of a surgical wound. Past circumstances should also be taken into account. For example, if a patient had chronic pain before surgery, it is likely that they will need a higher baseline dose of analgesia to manage previous pain as well as the new pain effectively. Validated clinical tools, including verbal, visual, and numerical scales and diagrams, have been developed to accurately assess pain levels and are critical in order to assess adequately, such as the visual analog scale. A large group of the Australian population of various ages and backgrounds have surgery every year, meaning they are susceptible to postoperative pain. Assessment is needed in order to recognise pain and treat accordingly. Poorly controlled pain may lead to a chronic pain state, further complicating the patient's recovery and quality of life. This also increases time in hospital as well as costs for the patient and the healthcare system in loss of productive clinical hours and more medications. Inadequate assessment leads to inappropriate control of postoperative pain, which may result in an increased need for rescue interventions, myocardial ischemia, immunosuppression, persistent postoperative pain states, immobility, poor physiotherapy, and prolonged recovery. The under-treatment of postoperative pain additionally has negative effects on the economics of a health system as a consequence of patient dissatisfaction. Pain assessment using validated clinical tools. Assess the gathered data in order to be able to create a tailored treatment plan in alignment with the patient's needs. Ensure delivery of all charted interventions and medications. Continually monitor the effectiveness of pain control. Referral needed if changes to treatment regime necessary. A popular pain management system for moderate to severe postoperative pain is patient-controlled analgesia using opioids, although use must be closely limited. There are both pros and cons to this method. Multimodal analgesia is an approach which involves the use of multiple analgesic drugs that act on different receptor sites. By using a combination of medications, a synergistic pain relief effect is produced and can reduce opioid analgesic use. This is desirable as adverse effects associated with opioids can be bypassed. Evidence has shown that there is potential great benefit of multimodal analgesia, although it is still underused. This could possibly be due to reliance on opioids in that they are usually highly effective for many people in producing strong pain relief. A multidisciplinary approach when consulting the client and providing resources can be useful for many reasons, including the management of postoperative pain. Nurses are directly involved in aspects of this. Educating the patient with the help of diagrams and simple descriptive terminology psychologically prepares them for what is to come and has been shown to reduce hospital stay lengths and even reduce the need for postoperative pain relief. Therefore, nursing education on pain management is of high priority because they are likely to be the ones that educate patients about their pain. To change clinicians' behaviours and achieve overall improvements, a combination of continuing education, organisational factors, and contact with other healthcare professionals is key. In-services regarding the latest information about pain management for patients should be conducted regularly. This helps to stress the importance of proper postoperative pain control and bridge the gap between the latest research and taking it into clinical practice. As student nurses, we can now be more aware of the risk of undertreatment of postoperative pain and use this knowledge in our future practice when managing postoperative patients.